Kate Tulenko is founder and CEO of Corvus Health. It's a global health firm. Kate, thanks so much for joining us again. Last month, Omicron entered into our lexicon, and there were a lot of unknowns. What have we since learned, and has that managed to alleviate some of the concern over the uncertainties?
Well, people are always concerned when they're unknown. So luckily we have been able to find out more about Omicron through both lab studies as well as studies of people who are vaccinated but get the Omicron. So we do know that in general, the disease tends to be less severe, but of course it's more transmissible. It might be as much as 15 times more transmissible than the regular COVID. And if more people catch COVID, more people who are high risk are going to get it, so you're going to have more people hospitalized. So I think that's the concern that we have. We do know from studies both by Pfizer as well as in Israel and some other national organizations are doing it as well, that the cases of Omicron in vaccinated people tend to be milder, but that the booster does help. So that's why you see in South Africa and elsewhere, they're recommending that people get that third booster of the Pfizer vaccine or Moderna.
So here in the U.S., Michigan is the new epicenter. Hospitals there say they're simply overwhelmed once again, but largely with unvaccinated people. How do you think this might color some of the discussions that are being had nationwide about possible vaccine mandates?
Well, I think unfortunately people are probably set in their opinions on vaccination. I don't think Omicron is going to make that much of a difference. So I do think in some parts of the U.S., such as New York City, which is now requiring boosters for indoor dining, you will see increased mandates. But I think in a lot of the red states, the conservative states, no matter what happens with Omicron, you will not see vaccine mandates. So I don't think people's opinions are going to change one way or the other.
Well, so let's look at some of the not red states, the blue states. New York State has reintroduced an indoor mask mandate. Colorado's governor has said states shouldn't tell people what to wear. These are both states controlled by Democrats, so blue states. What does this tell you about the breadth of opinions on how to tackle this?
It's, a lot of it's, based on, how the local constituents are reacting and how solid blue a state is. I think that's what you're seeing in Colorado. And certainly there's a lot of difference of opinion, but if you look at fact, all the fact points to the fact that masking protects people, vaccinations protect, and boosting protects. So there can be difference of opinion, but there really is no difference in fact here.
All right, so we're just a couple of weeks ahead of Christmas time when families gather across the country. Last year, the consensus was don't meet, or if you're meeting, keep small groups. Then into the new year, once vaccines were in place, if you're meeting with your family, people are vaccinated, take off your masks. It's okay. Given Omicron, should people be changing their expected behavior this holiday season?
I think almost 2 years into this pandemic, people are going to be meeting. I think we just have to acknowledge that, and we have to give them messaging on how better to protect themselves. So it will be have smaller get-togethers, make sure everyone's vaccinated and boosted, wear masks unless you're actively eating and drinking, and if someone is extremely vulnerable, perhaps it's best that they not join. And also avoid, mass transits, such as, airports, buses, train stations, because those are high-risk areas with a lot of people passing through, and avoid high-risk activities, such as activities with singing, which is known to really aerosolize the virus, or activities in which you can't social distance, such as large concerts or venues such as that.